and welcome to Wellbeing Wednesday. We at the Museums of the University of St Andrews are encouraging you to take 10 minutes for a break to listen to museum storytime. The objects in our collections and the people connected to them have had fascinating lives, and this is our chance to tell you their stories. My name's Eilidh and I'm going to be your host. Today I'll be telling you the story of Scotland's first female professor, none other than St Andrews' own Dr. Margaret Fairlie, a truly inspiring woman. Fairlie was born in 1891 and grew up in West Balmurmur Farm near Arbroath in Angus. She studied at the University of St Andrews School of Medicine and University College Dundee beginning in 1910. She graduated from the University of St Andrews with her Bachelor of Medicine, Bachelor of Surgery in 1915. She then went on to hold various medical posts in Dundee, in Edinburgh, in Perth, and at St Mary's Hospital in Manchester, where she trained in what became her specialism. She has a rather long list of accolades to her name, does our Dr. Fairlie. She was appointed head of Dundee Royal Infirmary's Department of Obstetrics and Gynaecology in 1936. Now, getting this role would usually lead to the appointee being made Professor of Obstetrics and Gynaecology at the University of St Andrews. However, her appointment was blocked and it took her 4 years to be rightfully granted that position. By receiving her rightful appointment, she made history and became Scotland's first female professor. She held the chair in Obstetrics and Gynaecology from 1940 until her retirement in 1956. But that is not all. She was also the consultant obstetrician and gynaecologist at Dundee Royal Infirmary. She was a fellow of the Royal College of Obstetricians and Gynaecologists and appointed in 1936. And she became a fellow of the Royal College of Surgeons in 1955. And the University of St Andrews awarded her an honorary doctorate of law in 1957. On her retiral, she became the Consultant Emeritus in Obstetrics, the first woman in Scotland to receive this title. Truly, she was a pioneer in her field. When she died in 1963, she was still the sole female professor in Scotland, and it would be a number of years before any other institution followed suit. But that's not all. Dr. Fairlie was also responsible for pioneering the use of radium in cancer treatment in Scotland. She introduced it to her work after a visit in 1926 to the Marie Curie Foundation in Paris. She even used her own savings to pay for radium supplies to use in life-saving treatment. She also organised follow-up clinics at Dundee Royal Infirmary for those patients that she had treated with radium. Now here's an interesting story. In World War II, all radium supplies in Scotland were commandeered as a safeguard against bombing, and apparently Dr. Fairlie's supply was buried deep in the Sidlaw Hills, just north of Dundee. But that's not all. Dr. Fairlie has even more strings to her bow. She developed the forerunner to today's smear tests, which have saved the lives of many women. She also set up the first antenatal clinic in Dundee to care for new mothers and their new arrivals. She was a well-loved and revered professor who painted watercolours, travelled the world, and even found time to keep a parrot. She lived at 8 Howard Place, St Andrews, in her retirement. Fairlie was, by definition, a trailblazer, and the effects of all of her achievements are still greatly felt on the world today. See you next time. Bye.